When I opened this clinic in August of 2023, I started my practice with approximately 360 patients. As of now, based on my last batch report and things I've been looking at, I have more than doubled my amount of patients in the span of a year. So it's really nice to have the comfort in knowing, oh, when I see my patient for the morning, I know that my virtual assistant is going to take care of that my virtual assistant is going to be on top of that. At the end of the day, WRS has been integral, the ease of the process of utilizing WRS with all of my processes, and how that is one stressor that I typically do not have to worry about because I have such good foundation and trust and backing through a good collaborative team.
I am thrilled to introduce Jessica Koupal, the owner of Mind Body Connections LLC. Jessica has been leveraging WRS Health's virtual assistant service since August 2023 and has been utilizing our billing services as well. Operating without on-site staff, she relies on virtual assistant for critical administrative tasks, including insurance verification and patient collections. And our billing team has helped streamline her revenue cycle. Jessica, before or when you were considering outsourcing your billing and front desk tasks, did you have any concerns or hesitations? If so, what were they?
Billing is very much a big part of a clinic, and utilizing assistance of any kind, those individuals are the face of your clinic, in essence. And when making the decision to do the partnership with WRS, it was the confidence of knowing that I had, with my virtual assistants, a constant stream of contact, always made aware and abreast of situations regarding patient communication, but also the zest and the forerun to decide to help with documentation and formatting paperwork for my practice, as well as keeping me informed on the latest up-to-date methods with regards to questionnaires for psychiatry, for example, as well as preliminary documentation for insurance and registration. And then with billing, the constant communication as well. Monica has been integral in my clinic practice, especially in her team of associates, and has always been available if I had any questions or concerns regarding any type of special situation or circumstance that we don't normally encounter in the insurance world, or even with the appropriate follow-up and always staying on top of the billing process and the submission of claims.
Now, how have our billing and VA services helped address those challenges and eased any initial concerns or hesitations you had?
I think it's very important, the transparency and communication and availability. So if I have questions, I can contact WRS directly through Monica, Lemuel, Rudolph, who's kind of the backbone of my billing team, and be able to get a prompt response. I never wait more than a day tops, if even a couple of hours, to get a response if I have questions. For example, if a client asks me about their deductible or asks me why their bill is what it is or how it was processed, I can get them a detailed, succinct answer right off the bat.
Now, let's move forward, or let's focus on virtual assistant services first. Before partnering with our virtual assistant service, what specific challenges were you experiencing with administrative tasks like e-statements, insurance verification, and patient collections?
As a single run clinic, there's a lot of moving pieces and parts when it comes to taking care of the client, outside of what I do, which is the documentation and medications and overall service. So those ancillary items behind the scenes create quite a busy environment day to day. So it's really nice to have the comfort in knowing, oh, when I see my patient for the morning, I know that my virtual assistant is going to take care of that my virtual assistant is going to be on top of that. And the concern was always, okay, if you relinquish that type of support and you're not always abreast of every single piece and part of that care of that patient, are you assured that that's happening if you're not the person directly handling it? And I think that that was a big concern when thinking about outsourcing for an assistant, a virtual assistant through WRS.
It's really important for us to have the correct people for the right role, for us to make sure that we are taking care of the clients instead of these admin tasks. Now, how has WRS Health virtual assistant service help resolve those issues and improve your administrative efficiency?
Absolutely. It has been amazing so far, the process. Again, my main team of people, Donna and Jay, are the individuals I rely on, and Catherine more than anybody else, especially with daily collection reports. That gives me right off the bat the ability to see, who may be struggling making their payments, what may be due for deductibles. They're very good about giving me the red comments underneath a patient's profile, which allows me to know, okay, if we're not able to make a connection with this patient before their appointment, then I know what's going on enough to say, hey, we need to have a conversation, or hey, this is your deductible today, and this is what we're working with. So it's definitely a collaborative approach, or a ladder approach. If one person cannot get to them, that I have the information necessary at the drop of a hat, right in hand, for me to have those conversations with patients. It's also been great, especially when formatting my clinical documentation and talking with Donna about a no-show policy, or a policy on controlled medications, or practice requirements. I just say, hey, is there any way that this can be drawn up for me? And immediately we'll get a response, and we'll get that documentation formatted for myself. The other thing that has been really great with virtual assistants too is when I say, hey, is there any way somebody can reach out and explain to this patient what's going on, or can we get a hold of this patient? They're very quick to, not a problem, we'll get a hold of them, we'll take care of it. And then they're also great with the collaboration with the overall team. So if there's a billing question, or I posit a question, and it's something that I've talked to Donna, Jay, or Catherine about, and they say, hey, you know what? This would be better addressed by the billing team. Let me reach out to Monica or Lemuel or Rudolph, and let's talk about that. Or, hey, this is a credentialing issue here, so I'm going to reach out to Riza for you and let her know what's going on, so that she can reach out back to you as your credentialer and give you some updates on how we need to proceed with this.
With the help of virtual assistant service, your practice has achieved a 100% eligibility confirmation ratio and 100% patient collection ratio. Those are truly outstanding results. Now, how has this success impacted your ability to focus on patient care and grow your practice?
It has been fantastic. When I opened this clinic in August of 2023, I started my practice with approximately 360 patients. As of now, based on my last batch report and things I've been looking at, I have more than doubled my amount of patients in the span of a year.
That's really fantastic to hear. I love that your clients have been doubled. The results you've achieved with the virtual assistant services are truly outstanding. Well, thank you so much for sharing that with us, Jessica.
Yes.
Now, let's move forward to partnering with WRS Health billing services. What were those what were the most significant challenges your practice faced in managing billing, credentialing, and insurance claims? And how did these issues affect your day-to-day operations and overall revenue cycle?
When you are working with an independent practice and you're an independent provider, a lot of oversight falls to you to make sure that items are coded correctly, things are billed correctly, all in the span of seeing the patient, doing the note, prescribing the medications, and then affording follow-up appointments. And that's a lot of circulating items. And you spend a lot of time and hours making sure that things are billed and up to code, and keeping track of, what as my profession stands as appropriate with regard to codes, what you can bill, what you can't bill, based on different professions. As a nurse practititioner, obviously there are certain things that are billed differently with the medical doctor versus a nurse practitioner. So being aware of all of that coding difference, because there are differences, especially in the psychiatric world, and taking the time to be knowledgeable on that, to make sure that you're billing correctly and getting the revenue. I think without the support or response of WRS, my revenue cycle, I think, would be much less. And I think some of my claims as well would not have gone as well. And I have had very minimal reports of return claims, and it's usually been an insurance issue. It's not been a billing issue. So I think that it probably would have been increased had I been dealing with it more commonly on a more independent sense over time, versus having WRS do that for me.
Jessica, how did WRS Health billing services help you overcome these challenges and help alleviate the concerns you initially had, particularly with credentialing, reducing aging, and resolving insurance accounts receivable.
The nice thing about having a team approach, especially when it comes to WRS, is again, those little things that add up to the big things when it comes to a claim. There are so many pieces and parts to it. So, for example, keeping up with credentialing. Riza is wonderful with updating me weekly, letting me know where my credentialing status was at, especially when I had insurances that were out there. Because obviously then we had to have the conversation with some of the patients entering my practice that the credentialing was still in progress, and what we could communicate to patients about, is this a self-pay? Do we suppress statements? Do we communicate that, you know, I really couldn't take a patient on until they had the appropriate insurance, and here's why. These are the safeguards we have in place based on what Riza would discover for me. I also recently got credentialed in a psychiatric testing through the ADOS-2, which measures autism spectrum disorder. And I had reached out to Riza and asked her about, hey, you know, am I credentialed to do this as part of my contract? And it saved me a multitude of time having to look through every single one of my contracts for every insurance company I was credentialed for to try and see if that was something that was billable based on my credentialing or my degree as a nurse practitioner. She got on that right away. She was able to, within the first week, give me 4 insurance companies that already could say, yes, Jessica could bill based on her credentialing and contract requirements, or hey, we will revamp her contract to include this type of psychiatric testing. So that was fantastic, because I thought, oh geez, I have to try and figure out how to do this in my limited time, and I didn't know if I would have the time before I was going to take this credentialing course. So Riza really allayed a lot of that stress with regards to figuring those things out. With billing, again, making the process more smooth and streamlined. I mean, I can't say enough. Monica she is a bulldog. I mean, she will get to the bottom of things right away. She is, I mean, very much on top of things. She is very much succinct in her processes. When I was struggling with the previous credentialer before coming over to WRS, she was fantastic about following up with that credentialer and me and keeping me in the loop with, hey, these are the things that need to be done. This is what we're seeing for your taxonomy and your NPI, and really helping guide and mentor that previous credentialer as well as me with regards to what taxonomies and NPIs were required to ensure appropriate billing of claims.
Well, thank you so much for sharing that. I love that there is a weekly update, there is a smooth communication. I know that credentialing is a long process, and I'm happy that the billing team was able to make it easier for you, Jessica. And these improvements have ensured that every claim billed has been successfully reimbursed, right? Now, what impact has this had on your financial stability and overall growth?
The ability to grow has been phenomenal because of the fact that my claims have been submitted. There's that trust with the insurance company, trust with my clinic. Everything is transparent with WRS through me. I can trust that they have the appropriate communication with the insurance companies to ensure that that trust and that collaboration with regards to my clinic, the clients that they entrust with my care through their insurance companies, and then that subsequent contact and appropriate billing and claims reimbursement that all of us need, you know, to ensure less stress for the patient and less stress for the clinic, because we know that we're getting those appropriate responses, we're getting those EOBs, we're getting that communication from insurance that things are billed appropriately, correctly, and there's appropriate oversight to that process to ensure that is successful.
It's very important that our clients will experience less stress and they will be more happier. They will come back to the clinic and, you know, endorse it to more clients and patients. Is there anything else that you would like to share with us?
No, I think, again, at the end of the day, WRS has been integral, and I am excited to have 2 more nurse practitioners joining my practice here coming up in the new year. And they are excited to learn the system and really appreciate it. Puts them at ease. How I've described the comfort of the ease of the process of utilizing WRS with all of my processes, and how that is one stressor that I typically do not have to worry about because I have such good foundation and trust and backing through a good collaborative team. So that really makes my 2 new providers very excited to join the practice too, because it will essentially be one less stressor for them as well.
Perfect. Thank you so much, Jessica, and congratulations.
Oh, thank you.
Practice. I'm really excited. I'm looking forward to you know, work with you moving forward. Thank you, Jessica.